Good morning, everyone. Just signing on. Like we usually do, we're just going to wait a couple minutes so some folks have some time, and then we'll get started here shortly. In the meantime, feel free to submit your questions in the comments, and we'll go through those.
That's me. I'm Dr. Hartwig, the Medical Director at Nimiipuu Health, here to provide some answers to questions that you might have surrounding the COVID-19 vaccinations. We have been receiving our Moderna COVID-19 vaccines from the Indian Health Service, and we have distributed 1,846 vaccines to date. Okay, Lenny, can you, it's like on the fourth tab of Excel, please. I just want to make sure I'm sorry, 1,876, and that's both prime, first doses, and booster, which are second doses. And then now to the daily data tab, please. And our current daily data to date, can't see the first column number, is 0.14 positive cases per day in the past 2 weeks. And our positivity rate, which is the number of positive tests per test that we ran in the past 2 weeks, is down at 3.39%, which is the lowest positive testing rate that we've had. We've generally been above 20% for much of the time during this pandemic, so seeing a value that low has been tremendous. We have 2 active cases currently, and still have our contact tracers working those cases and trying to keep our community safe. Our vaccination events occurred on February 12th and February 19th. The National Guard from the state of Idaho was in assistance for those vaccinations. Can you go back to the vaccination data, please? On the first vaccination date, we provided 211 vaccinations, and last Friday we provided 107 vaccinations. We still have about 56% of our patient panel at Nimiipuu Health. Those patients who were 18 years or older still have yet to be contacted for a Moderna vaccine. And so we still have a significant number of vaccinations to provide. If you are interested in receiving a vaccination, please contact the clinic, and you can find contact information on our website, also on the tribe's website. So if I'll just provide some basic information about the Moderna vaccine. It's an mRNA, which is a messenger RNA vaccine type. The 2 vaccinations that currently have emergency use authorization through the FDA are mRNA vaccines. mRNA vaccines have been studied since the late 90s with applications such as vaccines to HIV, Ebola, but they haven't had a good application, or as good of an application, rather than with the COVID-19 infection. So the generally nucleic acid information from the nucleus is transmitted from the genes to DNA to RNA and then to proteins. And if you all recall the COVID-19 structure that we've seen or picture that we've seen pretty routinely since the pandemic began, you have the spherical structure with the spikes that are protruding out on the surface. Those spikes have been termed the S protein. The S protein binds to our receptors and gains entry into our cells. The messenger RNA vaccines have taken a small portion of that S protein and enveloped it in a fatty envelope to allow entry into our cells. Once the mRNA gets into our cells, our bodies break it down and then present that mRNA to the surface of our cells, and then our immune systems mount a response. There are several variants that have surfaced, which viruses morph or change frequently, and there's been some media coverage touting a concern with the variations that are happening. The Moderna vaccine specifically shows that it may be a little bit less effective against the African strain, but showed that the UK strain, it was still sufficient. But one of the important things that you need to understand is that the vaccine is not a monoclonal response. It doesn't respond to just one protein. It's a polyclonal response. So there are several different modes of response that our immune systems are fostering. So there still is going to be efficacy against those, or it's still going to be effective against those different strains. Having a vaccine that's 95% effective is a tremendous development. I mean, the annual flu vaccine shows good coverage with 50% effectiveness. So the fact that we have one that's 95% effective is just tremendous. The common side effects that people have been experiencing have been fever, chills, body aches, headache, nauseous. In fact, after I received my second vaccine, I had all of those symptoms, and pretty severely. The body aches were just amazingly painful. And my first thought was those of you who have had COVID-19 and endured that body pain and those symptoms for 3, 7, or 10 days was just a tremendous challenge. Thankfully, ibuprofen was very beneficial for me, and those symptoms were short-lived, but that informed me when I experienced those symptoms that my body was mounting the immune response that it needed to respond or needed to mount in order to protect me from future infections, hopefully. Are there some questions or comments for us to reply to, Kaylani?
At this time, we don't have any questions, but feel free to go ahead and submit your questions in the comments. Perhaps one thing you could talk about is why it's so important to get both doses of the vaccine.
Thank you. The data shows that after the first dose of the vaccine, so both of the vaccines, the mRNA vaccines that have received EUA authorization, are a 2-dose series, and the Pfizer vaccine that the Public Health District is distributing has a 20-day period. So the first vaccine is provided, and then 20 days later you can receive the second vaccine. The Moderna vaccine has a 28-day window. So you receive the first vaccine, and then 28 days later you can receive the second vaccine. There is a 5-day grace period, plus or minus, that recommended vaccination date, but it's important that you receive both of them because with the first vaccination dose that's administered, the data shows that you have about 50% efficacy or coverage from the COVID-19 vaccine, and the full 95% that's been found in both the Pfizer and the Moderna data requires that second dose to be administered. Even after the vaccine has been administered, however, it's still important for us to mask, socially distance, and employ frequent hand washing to further reduce the risk. There aren't any vaccines that are going to be 100% effective and protect us completely, especially as we're starting to see these variants that are surfacing. The best protection against the variants is getting our community vaccinated so that mutation doesn't have a chance to mutate in our community.
Why is it still important to continue wearing masks and social distancing even though people are starting to get the vaccine?
As I just stated, the vaccines are not 100% effective, and with that, there's still a risk that somebody may contract the COVID-19 vaccine. And although I experienced the symptoms that I experienced as severe as I did, I would much rather have that half a day or day and a half of symptom experience than to experience or have to endure any long-term complications. Excuse me. There are several medical schools and places like Johns Hopkins who are beginning to develop studies around the long-term complications from COVID, particularly with emphasis on neurologic complications, because those side effects have been so common. I would personally choose to experience the horrific side effects that I experienced for the short amount of time that I did, rather than take the risk of getting long-term complications like chronic fatigue, reduced memory, recall, just general brain function has been one of the common concerns that we've heard from patients who have had COVID, and experiencing those long-term complications would make me again choose to receive the vaccine to avoid that risk.
Should kids get vaccinated? If so, when? At what age?
So there are ongoing studies, safety studies currently about when it is safe for kids to have vaccinations. The Pfizer vaccine has received EUA approval for 16 and older, children 16 and older. The Moderna vaccine currently has safety studies ongoing now for children 12 and older. Until we have enough safety data to recommend that children do get vaccinated, we need to do what we can in our communities to protect everybody else who can get vaccinated. So kids are not currently recommended to undergo vaccination with the Moderna, which is what we have. As I said, the Public Health District has the Pfizer, and they are distributing, or it's safe to distribute that to children 16 and older. However, I will tell you that on the Public Health District Tribal Situational Awareness meeting this morning, many of the regions in the state of Idaho are still providing community vaccines only to patients 65 and older. So the time with which they were going to get down to the children for vaccination is not known. Many of our community is vaccinating 18 and older population currently with any underlying medical conditions. So we are far above the curve in that distribution in getting the COVID-19 vaccination out. When we get information about safety information about children and vaccinations, we certainly will distribute that. But as of right now, the safety studies are still proceeding, so there aren't any recommendations for kids to get vaccines at this time.
After receiving both doses of the vaccine, if you are exposed to COVID-19, do you still need to quarantine?
No. The recommendations after, if you've been, so it has to have been at least 2 weeks after you've received the second dose, because your immune system is still mounting its immune response up to that 2-week time span. So no, you don't need to quarantine if you've had the vaccine, the second dose of the vaccine, at least 2 weeks prior. If you're in that 2-week window, then you should still quarantine because your immune system has not fully protected you against getting COVID. In fact, we've had some patients who have received the first vaccine and then got COVID, which illustrates the importance of receiving two, but just the timeline didn't quite match up. And if that situation happens where you receive the first dose, you get COVID, that 90-day time span or window of protection then begins, and the second dose would be after that 90-day time span has expired.
For low-risk people on reservations, will IHS be announcing vaccination clinics?
IHS is distributing the vaccines. Nimiipuu Health, which is not an IHS clinic, is distributing the vaccines. So in our community, Nimiipuu Health is responsible for the distribution. We do receive vaccinations from the Indian Health Service, but the Indian Health Service is not dictating to us who to distribute our vaccinations to. If you're in an area where the community has an Indian Health Service clinic, that would be a question for that specific clinic.
I'm wary about the side effects. My health hasn't been able to put up with extra problems. I'm just wondering what I should do.
Those health issues that you may be dealing with, and I don't know the details about them, but they may elevate your risk or increase your risk for having a more severe COVID infection. And we have had too much loss in our community from COVID. My recommendation would be that the side effects of the vaccination be endured for that long-term protection.
How long is the vaccine good for?
The current recommendations are that vaccines are good for at least a year, and we're waiting for the longitudinal. So longitudinal is a study that goes on a long period over time. We're waiting for that data to be analyzed. With the vaccine being so new, we don't have a lot of that information at this time about how long it will be effective, but the information that I have at this time is that it's going to be good at least a year, and there may be other recommendations or information that comes forward over time, but that's the best that I can give you today.
After your first round, how long do you have to wait to receive the second one?
So with the Moderna vaccine that we're providing, there's a 28-day period between the first dose that's administered to the second dose. And there is a 5-day grace period. So for our mass vaccination clinics, for example, we provided vaccinations on February 12th and February 19th. We are going to provide all of those booster doses, all of those second doses on the 18th of March. That's outside of that window, that time span for the those that were administered on the 12th, but there's not an end date of that second dose administration. There's just the shortened time that must be considered. It must be at least 28 days before that second dose is administered. So with that mass vaccination that we've provided those 300 doses, COVID the last couple of weeks, I just want to thank the community members for coming out. And as I stated, on March 18th, we will be providing all of those booster doses on a single day instead of 2 separate days, because the National Guard has been of assistance and we can handle administering the 300 all at one time. So just want to thank the community members for coming out, and if you have some questions about the vaccine, certainly we'll try to get back to you in a timely manner to help provide you with some information. But this is an opportunity. I feel like we need to get out information and try to replace misinformation from the vaccinations that may be out there, really to provide some protection for our community.
Perhaps you can just briefly discuss the process of approval for this vaccine, with it being an emergency declaration.
Sure. So the normal approval for vaccination is usually many years in process. There's a initial research and development timeline that's anywhere from 3 to 6 months. There's a phase 1 of a vaccine investigation where the research is done on very small numbers, 20 to 100 people, all healthy population again for another 3 to 6 months. And then phases 2 and 3 expand numbers in investigation, and that could be over a couple year time span to obtain safety data in kind of general population people, so they don't necessarily all have to be completely healthy in phase 2 and 3 trials. And then after all of those phases 1, 2, and 3, research development phase 1, 2, and 3 are completed, then production of the vaccination would take place. Because of the urgent need and over 500,000 lives that have been lost to COVID, it was recognized early on that the severity of this pandemic needed an alternative development for the vaccination. And so in the first phase, research and development that were developed took about 3 months, and they were conducted almost simultaneously. And I say almost because the first part of that 3-month time span, there was a significant amount of research and development that was conducted. If you think of a kind of a graded bar, if you will, where the research and development early on in the phase was really high, and then as that 3-month time span progressed, the research and development reduced. And vice versa for the phase 1, the healthy subjects, there was very little activity in the beginning, and then that phase 1 development increased over that 3-month time span. So those 2 phases were combined into one. And a similar circumstance was conducted with phase 2 and 3. Because of the knowledge that the scientific community already had about mRNA vaccinations, at the point of completion of research development in phase 1, production was initiated because of the confidence that the medical community had in the efficacy and safety of these vaccinations, with that historical research that had been conducted, as I said, since the late 90s. So in phase 2 and 3, a similar bar-like response where phase 2, in the 6-month time span, phase 2 comprised a significant portion of it in the beginning of that 6-month time span and tapered as we neared the end of the 6-month time span, and the phase 3 did just the opposite, got larger towards the end of that 6-month time span. But that entire time that the phase 2 and 3 was being conducted, the production of the vaccination was was being produced at that time. The federal government had guaranteed manufacturers purchasing of the vaccination, which removed any risk from the manufacturing component. And that insight by the federal government at that time was just tremendous to be able to prepare. So the EUA, Emergency Use Authorization, was released for the Moderna, I believe, on the 19th of December. And then we had vaccine the 22nd of December. So that short time span with approval to distribution was just amazing. And then the final portion of vaccine distribution is the safety monitoring, the continued safety monitoring, and that's an ongoing component of it. But I hope that that is somewhat clear in helping you to understand the curtailed or the shortened timeline for vaccine production and distribution with the COVID-19 vaccines.
And it looks like we have just one more question. Some people report having lumps on their necks after a shot. Can you speak to that?
Sure. So we have those lumps, they're called lymph nodes, really all over our bodies. And the function of a lymph node is it's kind of like a small egg, if you will. It's an oblong-shaped organ. And the job of a lymph node is to make white blood cells. So when you get a vaccination in your left arm, you might get some tenderness in your armpit or in your neck or in the back of your head, because these are regionally lymph nodes that this immunization will have taken that tissue in your bloodstream. And the reason that we give the vaccinations in a muscle is because there's a lot of blood flow. We want the vaccination to be dispersed to your body so that it can mount an immune response. That injection into a muscle, which is very, very high in blood flow, takes that vaccination and carries it to these regional lymph nodes. And those lymph nodes are part of your immune system that mount an immune response. So those lumps that are developed after a vaccine is administered is telling us that your body has received the vaccine, and now those lymph nodes are active, and they may be tender, they may be a little bit painful, but they're active in making the antibodies that you need to respond to that infection. So generally our immune systems, when it sees an infection for the first time, our immune systems might be a little bit puny in responding to that because it hasn't seen it before. This is a new foreign item, and our immune system is like, well, yeah, that's not you, but it doesn't, it might not mount a severe immune response, which is why some of those people who have had COVID have had recurrent symptoms very similar to their COVID infection. When our bodies see that infection the second time, our bodies are made to respond more quickly and in a higher level than the previous response, which is why we have 2 vaccinations. And that lump that your immune system is developing or has created after that vaccine was received tells us that your immune system is doing its job. It's preparing now for a subsequent exposure, whether it be via a second vaccine or by an exposure to COVID to fight it off. All right. Well, I hope that this has been helpful, and I welcome any questions that you may have regarding the COVID-19 vaccination. I'm really excited that our community has been able to offer 1,876 vaccinations. We have, I know, more vaccines that we're administering today. And I would just encourage you to strongly consider receiving the vaccination despite some of the side effects that you may experience, because those side effects are short-lived and not pleasant. I can vouch for that. in my experience after receiving my second dose was not pleasant, but very short-lived compared to the possible complications that may come from a COVID-19 infection. I want to commend our community for the response and the diligence and the trust that you've provided Nimiipuu Health through this pandemic. We've all struggled throughout this last year, but really appreciate your diligence and continued dedication to our community to keep everybody safe, and just hope that we can continue to provide vaccinations to everyone so that we can return to some sort of normalcy. Klatsiaia.